So systemic lupus erythematosus, or lupus, is a systemic autoimmune disease with multi-organ involvement. One of the challenges in treating lupus is that many patients have end organ involvement. So with renal involvement, there's a high prevalence of lupus nephritis affecting around 40% of adults, and some will progress to end-stage renal disease. These patients also have other end organ involvement and a higher risk of all-cause mortality, with increased incidence of cardiovascular disease as well. Metformin is a hypoglycemic agent we're all familiar with in its use in diabetes, and it has some anti-inflammatory effects. So ability to decrease immune cell activation and some reduction in pro-inflammatory cytokine production. Metformin has not been explored as a therapy clinically in patients with SLE, but has been studied in experimental mouse models, and some of that background was what led to this study. So this study was a retrospective cohort study using TriNetX, which is a global database of electronic medical records. And the study analyzed over 100 million patients from 88 healthcare centers across 4 countries. So they looked at patients with systemic lupus who were over the age of 18, admitted in an inpatient setting from 2014 to 2024. And they compared those who were taking metformin to those not on metformin using one-to-one propensity score matching and accounting for demographics, their labs like baseline A1C, comorbidities, and use of medications. So it's interesting, they found that patients with lupus on metformin, as you might expect, had greater prevalence of type 2 diabetes, hypertension, hyperlipidemia, and prediabetes. And then after the propensity score matching, those that had SLE that were on metformin had a higher A1C, and those with lupus not on metformin had higher levels of BUN. And then within 1 year, they found that those not on metformin had a higher risk of developing biopsy-proven lupus nephritis and had a higher risk of major adverse cardiovascular events compared to those patients with lupus who were on metformin. Then following 5 years of diagnosis, there was a similar increased risk of lupus nephritis as well as chronic kidney disease, stage 1 to 3 in those not on metformin. But the MACE risk was no longer statistically significant at the 5-year point. So overall, these studies suggest there may be a protective effect of metformin against progression of renal disease in patients with SLE. So this study was a retrospective review, and so there may be some confounding variables that we're not accounting for that could explain some of these results. The authors also were unable to confirm the accuracy of the ICD-10 diagnosis codes for lupus and sort of the electronic health record accuracy. They also were unable to obtain disease activity measures for their lupus activity for these patients or information on the specific class of lupus nephritis, so some limitations in interpreting these results. I think this study was a novel real-world database study looking at patients with systemic lupus who are on metformin and showed that there is somewhat of a reduced risk of adverse events in those on metformin for other indications outside of their lupus compared to those not on metformin, including a lower risk of lupus nephritis, chronic kidney disease, and the major adverse cardiovascular events. So these findings suggest that metformin may have a potential anti-inflammatory effect or some sort of immunomodulatory property in patients with SLE that are actually preventing the progression of renal disease and lowering the risk of these cardiovascular events. And as I mentioned earlier, it's a retrospective study, so we need further clinical trials, randomized control studies, and additional investigation to further validate these findings. to see if there could be a potential role in utilizing metformin in lupus and lupus nephritis.